Many patients who have spine problems have pain.
What you hear often from patients is, "I'm so glad to know that there is some hope."
Our goal for every single patient is simple. It's to make them better. The majority of people, as they progress through their lives, will have an episode of neck or back pain. The spine involves anything from the bottom of the skull all the way to the sacrum. In the Center for Spine Health, we have a team of experts that can treat any problem emanating from any portion of the spine, from the most simple to the most complex.
We have world-renowned, world experts in surgery, interventional, and medical management of spine disease here at Cleveland Clinic.
The Center for Spine Health is what's called an integrated practice unit. We have over 50 care providers who work collectively as a team to render the absolute best care for each patient using the best evidence in the medical literature and employing the most advanced technologies. Among us, we have over 150 years of surgical and clinical experience treating patients with spine problems.
We have every part of the team that patient's going to need in one place to provide that care for them. Our offices are next to each other, so we're constantly in communication all around that patient's problem.
Our doctors are always trying to look for the best way, and the best way is often not a surgical strategy, but some other less expensive and more effective way of dealing with patients' problems.
We treat everybody with respect. We want to make sure that we truly understand the problem that they're facing, because many of the patients we see are suffering, they're in terrible pain, and our goal is to try to provide a relief of that pain.
Oftentimes, we are the last stop for patients, and you can see it on their faces. They are told at other institutions, "There's nothing left that I can do for you." But when they come to us, many times the source of their pain is obvious.
We see patients that have had surgeries elsewhere and have come to seek another opinion from us. We figure out why they're continuing to have pain or disability from the operation that was done, and we reconstruct that spine or redo the operation and get the patient back to good quality functional life afterwards.
At Cleveland Clinic, we are fortunate to have access to the best technologies. In the operating room, for example, we have navigational units that allow us to work around spinal nerves and the spinal cord more safely and more accurately, and we can place our instrumentation with more precision. And ultimately, these technologies allow us to render better outcomes for each patient that goes to the operating room.
Cleveland Clinic has been a leader in less invasive surgery or minimally invasive surgery to the spine, and this stems from our research and innovation and image guidance to see the spine without actually having to expose it through a big incision. We are one of the top research centers that are putting out clinical and basic research that allows us to be innovators, bring that cutting edge to patient care.
We are known on a national and international level. Among all of the staff, we have over 1,000 publications in the peer-reviewed medical literature just from our own research.
We work really hard to get these patients to a better place. We restore function and provide knowledge that can really transform people from a life of misery into a life of normalcy.
We take great pride in approaching every single patient in a very personalized manner.
Patients come in a wheelchair, they're on chronic narcotics, then we see them at that 1-year mark, and now they walk in, they've weaned down to no pain medication.
Just to see them better, to see them without pain, and their quality of life is improved. That's why we show up to work every day.
We want to make sure you get back to that quality of life, doing what makes you happy, and that's our overarching goal.